Hello and welcome. My name is Raj Persaud and I'm a consultant psychiatrist based in private practice in London. And I'm delighted to be joined today by Helen Barbour, who's written a novel. The novel is entitled The A to Z of Normal. And this book is published by Silverwood Books and is available from all good bookshops and also available to be ordered from Amazon. What's really interesting about this book is it's a very detailed kind of first-person account of what it's like to suffer from an aspect of obsessive compulsive disorder, which doesn't frequently get a lot of attention. And this is a kind of disorder where the predominant symptoms are things to do with checking and with order. So, Helen, let me start by asking you, tell us a bit about the plot of your novel.
Okay, well, hello, Raj, and thank you for giving me this opportunity to talk to you about my book and my own experiences of OCD. So, as you say, the story is a first-person account. It's the account of Claire, a woman in her early 30s who's trying to overcome her obsessive-compulsive behaviour in order to marry the man that she loves. She's just become engaged, but immediately is faced with the problem of her obsessive-compulsive behaviours. In the course of the novel, she wants to change, and she really tries to, but in the process, the whole situation gets more complicated and she risks losing everything, including Tom. And in fact, it's one of the solutions she pursues that actually puts her future with Tom in jeopardy. So the question running throughout the novel is whether Claire will ever find the right way forward and actually be able to establish a life with Tom in light of those problems that she has.
Now, the main character has various symptoms and they're very well described, and I think they arise out of your own personal experiences.
Yeah,
How would you describe the symptoms that the character has in the novel?
Well, Claire's a very anxious person, but she's also obsessed with achieving order and symmetry. And these obsessions are specifically related to her environment. So her flat, her office, her car. She has a set of rules which govern the position of everything she owns, which are very much rooted in what feels right to her, which is a very sort of characteristic of OCD. It's often what feels right to the person who's suffering from the condition. So the layout of a particular set of objects may look aesthetically pleasing to an outsider, but for Claire, it's not just about how they look, but how that positioning actually makes her feel. So, for example, glasses sorted in ascending order of size from left to right would make her deeply uncomfortable. She has to have them displayed in descending order of size from left to right. So it seems like a very fine differentiation, but it's that all important what feels right to her.
Could you give us some other examples of her symptoms?
Of her symptoms, what the kind of things that she carries out.
Yes.
Yeah. So quite early on in the book, she carries out an experiment in the kitchen of Tom's cottage. Tom is her partner, and she wonders if maybe she can impose the same kind of order in his home, which will ultimately become their home, if she can do that there, and if that's a way forward, if she could just carry her behaviours into that environment. So she starts by trying to organise the tins in the cupboard, which for her has to be done in a very specific way. So first of all, she'll sort them by category of food, so whether they're savoury or sweet. Then she'll sort them by size. So again, like the glasses, that would be from big to small, going from left to right. And finally, she makes sure the wording on the label is centred. So as you look at the tins, they will have to be centred, and if they're stacked up, they need to be lined up with each other. And in the same way at home, she lines up things on her dressing table, like little ranks of soldiers, very evenly spaced. She makes sure the spaces between the hangers in her wardrobe are all the same. She'd make a very good shop assistant. She folds her clothes into very neat squares, kind of T-shirt piles you see in Gap or places like that. She piles her clothes into those kind of shop piles with the corners all lined up. Essentially, everything she owns has an allocated position, which she's determined according to how it best fits in with the others around it. And that best fit means, again, what feels right to her in that environment.
But it's also the case that when things aren't in the right order or arranged as she wants them to be, she gets very upset and becomes very anxious, and there's a lot of suffering involved.
There is, yes.
Is that a fair description?
Absolutely, yes. It's very, very difficult for her to see people. And again, I've taken this from my own experience. It's very difficult to see people move things. I'm in a better position than she is, and for me, I can tolerate it knowing that I can put them back, when that person's gone. But yes, and when on the odd occasion I have to have strangers in my home, such as boiler engineers, I'm constantly watching them, for in case they move anything. So, and Claire very much experiences the same thing, that anxiety about someone changing her environment.
Now, a lot of people hearing about these symptoms as preoccupation with order and arrangement would find that a very strange thing to hear about. But these are very well-known symptoms, and they're part of a spectrum of a particular disorder referred to as obsessive compulsive disorder. Do you agree with that assessment? Do you agree that there's a thing called obsessive compulsive disorder and that these are symptoms of that disorder?
Yes, absolutely, and Claire definitely. I've intended that she should have a obsessive compulsive disorder, which sounds rather unkind, doesn't it? As a writer, you can flick whatever you like on your characters. So so that to me is what she has. The key factor being that she does experience that anxiety and distress we talked about if she can't carry out her ordering compulsions, which obviously is the hallmark of OCD, compared to someone who is, say, just a neat freak, which of course a lot of people with OCD will be accused of being a neat freak. But our experiences and Claire's experiences of ordering are actually a much deeper psychological issue. So yes, she's very much got that, yes.
And her symptoms, do they relate directly to experiences you've had in your life? Are all her symptoms your symptoms? And in what way is your experience different from hers?
I've very much attributed my symptoms to Claire. The age-old advice to writers is write what you know, and OCD is obviously something I've experienced and I continue to experience. And I really wanted to convey what it's like to live with this disorder, as it is very poorly understood by most people. I felt it was something different that you mentioned at the outset, that it's something that isn't covered very often, and I felt it was something that I had experienced and I could share and should share. And obviously there is still a lot of stigma around mental health, and without wanting to be didactic about it or too preachy, I really wanted that subject to be at the heart of my sort of my first major fictional work. So yeah, I thought it was I've tried to do it. Having said that, I don't want people to think this is some kind of misery memoir. It's not at all autobiographical. I mean, Claire is not me. She, in most senses, she's not me. I don't have her family relationships. I haven't undergone her actual experiences with her partner, but she has my OCD. And I've tried to inject some humour and a light touch to it as well, because even those of us with OCD can see the humour in our situation at times. So I think that's quite important also. It's not... it's something a lot of people live with. They do live with it secretly, and they carry on with their lives. It's part of their lives. So I wanted to get that across. So.
Could you tell us a bit more about your symptoms? In particular, I'm thinking about a time in your life when they may have been at their very worst, and maybe you could relate an incident which was when things were at their very worst for you.
I think... I don't know if I can think of a particular incident, but when they were at their very worst, and probably I'm relatively fortunate in that my OCD has only ever hit the sort of moderately bad symptoms at its very worst. It was probably when I just separated from my husband. I think that was a sort of whole triggering year for me. I had a lot of big life events, very negative life events, including separation from my husband. And I sort of thought that my ordering habits, which were becoming apparent, I thought they would resolve once I had my own place, and in fact they got worse, because I could exert complete control over my environment with no fear of anybody else interfering, and at that point, rather than getting better, I did get significantly worse, and I couldn't leave my flat unless everything was absolutely perfectly in its place. The bed had to be made, all the dishes had to be put away, and incidentally the patterns on the plates had to be lined up when I put them away. Everything had to be absolutely spot on before I could step out the door, and I literally couldn't have anyone in my home. I would only have people in my home in an absolute emergency, the electricity's gone wrong or something. But friends, family, I had my parents around, but even then it was very difficult, to tolerate having anybody in my environment. So I remember my ambition when I was receiving treatment. I told him I wanted to be able to have someone to stay in my flat overnight. And I can do that now. So that's, things have moved on. And even when I think I really need to address this and nail this more than I am doing, I remember those days and that things were a lot worse. So.
You said that you couldn't leave the flat unless everything was exactly in the right place. So can I ask, how long would it take you before you could leave the flat? Or were there some days where you actually couldn't leave the flat?
Well, I wasn't housebound. I was never housebound. That would make it sound a lot worse than it was. I could leave the flat, but, it's very hard to say how long it would take, because each individual thing can take you you can just get stuck for 5 minutes because you're not quite satisfied that something's in the right position. So yeah, maybe yes, it's very hard to put a figure on it, to be honest. And it is right; it's quite a long time ago that I was that bad. It's sort of been a little bit archived in my memory. But actually, what I should have mentioned as well when I was particularly bad was I had other little odd rituals which weren't really, I mean, they were OCD, but they weren't ordering. One of the things I do recall doing was touching all the cupboards in my kitchen. I had to go around and touch them, top, bottom, all the way around before I could leave the kitchen. And again, it was that thing of feeling right. If I didn't feel I'd done it quite right, I'd have to do it again, and before I could shut the door on the kitchen. So yeah, that was another example of a sort of particularly low point. Yeah.
Now that touching ritual is interesting because that's one of the examples of where people with OCD can, to an external observer, almost look a bit psychotic.
Yes.
And so
yes.
so it can look very bizarre, some of these rituals.
Absolutely. And I think now, even though I'm very open in speaking to friends and colleagues and just about anyone who'll listen about OCD, I would try to avoid anybody seeing me do it. I mean, I live in a small block of flats. There's 12 flats. We have small common hallways outside each pair of flats, and people keep their shoes outside, and I have a shoe rack, and they have to be lined up just so, like everything else in my life. But of course, inevitably, people are coming past as they're coming in out of the building. So a number of times I have dived back into my flat and waited till the person's gone past so that I can come back out and resume, because I can't leave it until it feels right. So yeah, ducking and diving and wait until the end of the day at work until there's no one really looking, so you can put everything right on your desk, because you know it's ridiculous, and that's something I think that to an outsider they think, well, why can't you just fix it then? Why it's ridiculous, why don't you just stop doing it? But it's not that simple, as we all know. So
what are your views on the treatments available for this kind of problem?
Well, my own experience of any sort of professional treatment has been a bit limited. I first went to my doctor about 20 years ago, around the time I split up with my husband and was at a particularly low point and realised that rather than getting better, I was getting worse. Went to my GP, and things were very different then, of course, in terms of how much people knew about mental health or talked about it, and also the extent of help that was available. I was fortunate that my GP was very understanding, and she referred me to an occupational therapist. So I don't remember him using the terminology of the sort of recognised treatments that people would say are the top line treatments, the cognitive behavioural therapy, the exposure and response prevention. I don't remember him calling what we were doing that, but I am aware now that what we were doing, he did introduce me to exposure and response prevention, which I still try and remember and use. And I haven't accessed any professional treatment since then, but I think although sufferers can help themselves a great deal through books and all the information that's available online and support groups, I think a professional steer, I think, is probably invaluable, and someone to help you keep on track, because it's very easy, like trying to stop doing anything, whether it's drinking, eating too much, or OCD habits, unless you're sort of reporting into someone or you've got something you're aiming for, it's very easy just to let it slide. And so I think professional help is invaluable. I just haven't accessed enough of it myself, I think.
Let's talk a little bit about what you referred to as exposure and response prevention. Could you describe what that means practically?
It means doing the thing you don't want to do. So in my case, leaving things in a mess. And that is very hard for someone to understand, that if you have ordering OCD, leaving things in a mess, it is literally, for me, it's having something a centimetre off from the position it should be. I'm not talking about having a kitchen full of dirty coffee mugs and pizza boxes and clothes all over the floor. So what you would do in my case is move something, or not fold your clothes up in the way you would normally, and just plonk them in the drawer and walk away. And you're going to feel anxious about that. And the idea is that you ride out that anxiety, and over time it will subside, and you learn to deal with it, because the habits are there to try and reduce that anxiety, and you need to learn to live with it and to recognize it will go away if you just leave it be and don't indulge in your compulsions. So yeah, sometimes when I try it, because I must confess, I tend to do it when I realize things are taking a bit of a downturn, and I'm perhaps enacting more compulsions than I ought to be, well, not that I should be doing any, but I'm enacting more compulsions than normal, that are normal for me. I try and do it, and occasionally I find it quite briefly it's quite liberating. I think this is quite common in people with OCD. It can feel quite freeing and exciting and rebellious, and oh gosh, I'm not complying with what OCD wants me to do, and then you have a bit of a crash half an hour later, and you find yourself scurrying back to put the object back in the right place or fold the clothes in the right way, because that sort of initial euphoria becomes replaced with anxiety. So it's a challenging process, and it's easy to see why a lot of sufferers avoid treatment, because sometimes it can seem harder than living with the condition itself, I think.
I think that's a very important point, and I think you've given a very clear description of what exposure and response prevention means. But the reality is that in the short run, at least, it actually makes you feel worse. You get more anxious as a result of the treatment. And that's why people, I think, reject the treatment. But in the long run, if you persist with it, you end up with lower anxiety.
Yeah.
But that's the big hurdle that sufferers have to cross, isn't it? What are your thoughts about that?
No, absolutely. It's very difficult to see that bigger picture, and it does just feel like things are getting worse. And I think there's something as well about you're used to that state of being. I've heard, for example, he has a different condition, Stephen Fry. Obviously, he is a bipolar manic depressive, but I've heard him being interviewed, and he said, he wouldn't want that taken away from him. Someone said to him, if you could just have it all taken away from you. And he said, no, it may be because for a lot of manic depressives, that manic phase is the bit where they get creative. And that's obviously an important thing in his life. But you would think that also the downsides he's had, that he would be glad to get rid of it. But actually, there's that slight fear as well, I think, of if I lose this part of me, what else might change? Am I not going to be the person that I was anymore? And of course you're not, but you're probably going to be a better off person than you were. But it can be quite frightening. Strangely, it can be quite frightening to let go, I think.
Another aspect that comes through in the book very well, I think, is the secrecy around obsessive compulsive disorder, and in particular, this particular version that we're discussing. The character kind of turns somersaults to keep it secret. Do you think that's a big factor in this disorder?
Oh, absolutely. I mean, as I mentioned, we know that what we're doing, most people, they know that what they're doing is odd and strange. They can recognise that themselves. And actually, depending on the severity of your symptoms and your own individual circumstances, and with a bit of ingenuity, you can actually hide things for quite some time. When I found myself then living on my own, well, there was no one to stop me. I could just carry on, and you arrange to meet friends elsewhere, and it's actually quite easy to keep people out of your home environment, but it depends on what your kind of OCD is. If you're stuck, if you're a teenager who's got contamination issues and spends an hour in the bathroom and no one else can get in the morning, it's going to be harder to keep secret. And it's a little bit, I think a lot of people are dealing with a lot of things in life that they're keeping secret successfully. Alcoholics, drug addicts. We just become very, very cunning in how we hide it.
And how did this secrecy relate to your life?
Well, I mentioned that I'd split up with my husband, and it might seem very strange to believe, but that was when my OCD really started to become intrusive in my life. I was still with my husband. I think probably the stress, our relationship wasn't going well, and that obviously contributed to my OCD. And I began my ordering habits when we were still together. But strangely, he had no idea I was doing it because he left for work before me in the morning. So I had time to get everything back in its place before I left the flat for work. And then I would get back before him so I could enjoy a bit of undisturbed time where everything was exactly to my liking. And at that stage, I wasn't bad enough that I couldn't tolerate that. I could tolerate it because I knew, well, he'll be out in the morning and I can put it right in the morning. So at that stage, I could, which is sort of the stage I'm at now. I've gone back to that stage where my boyfriend can come around and things can be moved, and I think, well, I'll put it right when he goes. And I asked my husband about it subsequently, thinking, could you really not have noticed? And he genuinely never did. I think he just saw that we had a very tidy home, but he was oblivious to the fact I was positioning things with absolute millimetre precision. I do remember one day we had those wardrobes where it was a sort of gentleman's wardrobe with a small coat section and some drawers underneath, and I had a full-length ladies' wardrobe, and they were next to each other in the bedroom, but mine was sort of in a corner, and I happened to leave the doors open, and he happened to notice because I had all the hangers evenly spaced, and to him that just probably looked insanely tidy. And he said, gosh, your wardrobe's very tidy. And I closed those doors very quickly and made sure he never saw inside my wardrobe again. But it's amazing. I think people would find it amazing that you can be living with someone and that they're not aware of what you're doing. I mean, had things progressed and I'd got to that point that I reached in my own flat, I'm sure he would have noticed if I'd started touching cupboards and, taking an hour to leave the house. But it's amazing what you can keep secret, even living with somebody else.
So if we think about a little experiment, a nightmare experiment from your standpoint, if we took you back to that bedroom and rearranged the wardrobe so it was all higgledy-piggledy, and you were not allowed to intervene with that wardrobe, you had to stay there and be in a room where everything's been changed around in a way that you don't like, and you had to tolerate that for hours on end or days on end, what bad thing do you think would happen?
Well, now you see, this is something I have realised. I write a blog as well about my experiences, and I've realised in the last few years from other people's experiences that most people do have a fear of something bad happening if they don't enact their compulsions. And I thought, well, this is strange because I don't really have anything in mind. I don't think anything's going to happen. Why am I doing it? And I dug into it a bit deeper, and I used the David Veal and Rob Wilson book a lot, the Overcoming Obsessive Compulsive Disorder. That's kind of my self-help Bible. And they explain that there are some people who they've got to a point where it's actually the anxiety they fear. It's not, I don't have a specific fear. I don't think my parents are going to die or my boyfriend's going to get knocked off his bike. I just can't tolerate that. It's the fear. It's the anxiety I'm trying to get away from. So yeah, strangely, I don't have a particular fear, which I know is very common. And I think that's another thing about OCD, and I'm sure a lot of other conditions, that everybody's experience is so very different. It can be hard even to understand another person's experience. That person who's fearful that if they don't wash enough, their baby's going to die from an illness. That's not something I can relate to. I can understand it, but I don't really relate to it in the same way, I think, because I don't feel that way.
I don't want you to spoil the ending of your novel, and it's a riveting read, but what are your thoughts about the resolution of this problem? Do you think it's resolvable? Do you think it's treatable? And how does that link back to the ending of your novel? I don't want you to give away the ending, obviously. No. But any thoughts about that?
Yeah, I mean, I think it is treatable, but I seem to recall years ago reading various debates between sufferers and professionals about whether it could be cured. Looking into it again recently, it seems to be now a general thinking that I would agree with, that it's a chronic condition. I don't think you're ever cured. I don't think it ever completely goes away. I think you can exist with very mild symptoms, which may, in the wrong circumstances, depending on what your triggers might be, which can then rear its ugly head again and become much more of an impact on your life. So I think sufferers just need to be prepared with the right tools to recognise any kind of downturn in any downslides, and also have the tools in place to deal with that, and be aware of the treatments and the exposure response prevention and how to actually address that. And I think in my novel, Claire, as we've said, treatment is difficult, and sufferers will do anything they can sometimes to avoid it and find another way out. And I think Claire she receives a lot of good and bad advice on her journey, and the bad advice she grabs at that, because that suggestion is that some other people should pander to her compulsions, and she grabs at that as an apparent solution, but she realizes that isn't a solution, and it is treatable, and the only person who can deal with that is herself. And so yeah, by the end of the novel, she's come to realization, and she's continuing to work towards that. But yeah, it's easy to grab at straws.
But one of the things I think is very important about your novel is, and it's a very well-written book and a riveting read, and I would recommend it to either those who are interested in OCD or those who are just interested in a good read. But what I think is core about your novel and reflects my own clinical experience, I mean, I going to disagree with you a bit. I think it's completely treatable.
Oh, do you?
However, it depends on whether you want it treated. You see, what's interesting about your novel is for the very first time, she decides to think about changing because there's something that comes into her life, another person that she wants to consider marrying. And so she has a goal now, which is to be with this person, and that represents a conflict with her OCD. And that's why she's confronting the OCD, or it becomes a problem for the first time. So I think the core issue is, what do we want from our lives? And there's some people who just prefer to have the OCD. However, if the OCD is getting in the way of a key goal, that's what presents the opportunity for treatment. But you have to really want the goal that you're, the man you want to live with, or the job you don't want to lose. You want to want that more than the OCD, and that's the core question. I wonder what your thoughts are about that.
Well, I think that's really interesting, actually, because I think I would say I've been quite lazy in addressing mine. That I let it ride up and down on that spectrum of mild to moderate, depending on what's going on in my life. I had a particularly difficult year last year when I think things then started sliding down again. But like you, I think probably the reason I've been lazy and I've avoided addressing it and completely nailing it is that I can manage. I would say that I'm on the sort of high functioning end of the spectrum. It intrudes in my life, but it's not stopping me doing what I want to do, so that I don't have any imperative to completely get rid of it. However, just taking you back to when you said you think it's completely treatable, I mean, maybe the other people, I engage with a lot of people on Twitter and other social media about OCD, and maybe those people who say the same as me, that they think it's chronic and they never get rid of it, maybe they're in the same state of denial. But from what you're saying, there is therefore still some question. I don't know how you find it in your professional capacity, whether all professionals agree with you, or if there is still some who would say it's chronic and you never get rid of it. What's the
Well, I don't think there are as many professionals as are optimistic as I am. However, I want to come back to the point. You can get rid of it, but you have to want to get rid of it. You have to have a goal that gets in the way of it. But anyway, that's a debate I'm sure we could have for a long time. We're running out of time. I just want to thank you very much for talking to us, and thank you very much for this wonderful book. Just to run over the details of the book again, it's called The A to Z of Normal. It's written by Helen Barbour, Barbour, and it's published by Silverwood Books, and it's just out now, it's available for pre-order. You can get it from all good bookshops, and you can get it from Amazon as well. So Helen, thank you very much indeed.
Thank you, Raj. It's been an absolute pleasure. Thank you for the chance to talk to you.